Now that you've clicked on this video, please give me 8 minutes to explain gestational diabetes. What tests should be performed between 20 and 30 weeks of pregnancy or during the last trimester? The recent increases in GDM numbers have raised concerns on the impact on the healthcare system and quality of life. This video is divided into 3 sections. Number 1. Understanding gestational diabetes, or why many pregnant women are suffering from it lately. Number 2. What happens to your body if you get gestational diabetes? Number 3. Timely and accurate diagnosis tests. Understanding gestational diabetes, and why many pregnant women are suffering from it lately? Gestational diabetes is high blood sugar during pregnancy. Developing GD doesn't mean you already had diabetes before you got pregnant. The condition appears because of pregnancy. People with type 1 and type 2 diabetes before pregnancy have their own separate challenges when they become pregnant. Gestational diabetes commonly arises in the middle of pregnancy, between weeks 24 and 28. Your pregnancy care provider will request a blood test to check for gestational diabetes. Gestational diabetes, GDM, is more prevalent today due to a number of factors including obesity, age, ethnicity. The prevalence of obesity in women of childbearing age has increased dramatically worldwide. A history of gestational diabetes in previous pregnancies, being older than 25, a family history of diabetes, as well as ethnicity, increased the risk. Hormonal changes. During pregnancy, hormonal shifts can interfere with insulin function, leading to insulin resistance. This resistance hampers the body's ability to use insulin effectively, causing blood sugar levels to rise. Effective dietary and lifestyle. Incorporating processed foods and a lot of junk food into our diet has caused health deterioration, which is one of the leading reasons of gestational diabetes. The COVID-19 pandemic led to a sedentary lifestyle for many women, which can increase the risk of GDM. Insufficient insulin production. Some women may not produce enough insulin to counteract the insulin resistance induced by pregnancy hormones, leading to elevated blood sugar levels. Placental hormones. The placenta produces hormones that help sustain the pregnancy, but can also impede insulin's action in the mother's body, contributing to gestational diabetes. Number 2. What happens to your body if you're diagnosed with gestational diabetes? Gestational diabetes occurs during pregnancy when your body cannot produce enough insulin to meet the increased demands. This process usually happens between the 24th and 28th weeks of pregnancy, as hormonal changes affect your ability to use insulin effectively. In a typical scenario, your pancreas releases insulin in response to food intake. However, increased levels of hormones and other substances in your body during pregnancy can lead to insulin resistance. Increased blood sugar levels. As your insulin levels drop and resistance heightens, you may experience elevated blood sugar levels. This condition, known as hyperglycemia, can have several internal effects. Your body may attempt to compensate by producing more insulin, but if your pancreas cannot keep up, your glucose levels will continue to rise. Elevated blood sugar can impair your body's ability to use glucose for energy, leading to a cycle of fatigue. Impact on amniotic fluid and baby's health. High blood sugar can influence the amount of amniotic fluid surrounding your baby. Increased levels of glucose can lead to a condition called polyhydramnios, which is an excessive accumulation of amniotic fluid. This can potentially lead to premature labor or complications during delivery. Furthermore, the sugar in your bloodstream crosses the placenta, providing your baby with additional glucose. As a result, your baby may grow larger than average, a condition referred to as macrosomia. Larger babies can increase the risk of delivery complications, such as shoulder dystocia, where the baby's shoulder gets stuck during birth, or lead to cesarean delivery. Hormonal and metabolic changes. Your hormonal landscape also shifts as a result of gestational diabetes. Insulin resistance not only affects insulin levels, but can also impact other hormones involved in metabolism. These hormonal changes may contribute to increased appetite and cravings, causing imbalances in your nutritional intake that can further complicate your blood sugar management. Additionally, the stress of managing gestational diabetes can result in elevated cortisol levels, often known as the stress hormone. Prolonged elevated cortisol may lead to other health issues if not addressed, thus making it essential to practice self-care and stress management techniques. Right time and accurate diagnosis measures. Typically, you'll undergo screening for gestational diabetes between the 24th and 28th week of your pregnancy. However, if you have risk factors, such as a history of gestational diabetes, being overweight prior to pregnancy, or having a family history of diabetes, you may be tested earlier. The most accurate tests suggested by physicians are glucose challenge test, GCT, and oral glucose tolerance test, OGTT. Hemoglobin A1c, HbA1c, is a blood test that can be used to screen for diabetes in early pregnancy. HbA1c is less reliable than other methods for diagnosing GDM. The glucose challenge test, GCT. Your healthcare provider will likely start with the glucose challenge test, GCT. This is a simple non-fasting test. Here's what you need to do. 1. Drink a glucose solution. You will be asked to consume a sugary drink that contains 50 grams of glucose. This drink is designed to raise your blood sugar levels. 2. Wait and relax. After consuming the drink, you'll wait for about an hour. This is your time to relax, as the sugar will flow into your bloodstream. 3. Blood sample. After the hour is up, a healthcare professional will draw your blood to check your blood sugar level. If your results come back normal, you might not need further testing. However, if your blood sugar level exceeds the predetermined threshold, usually around 130 to 140 mg/dl, you'll be scheduled for a follow-up test. The oral glucose tolerance test, OGTT. If your GCT results indicate potential diabetes, you will undergo the oral glucose tolerance test, OGTT. This test is more comprehensive. 1. Fasting requirement. You'll need to fast overnight, which means not consuming any food or drink for at least 8 hours beforehand. 2. Initial blood sample. Upon arrival, your blood will be drawn to measure your fasting blood sugar level. 3. Glucose intake. Similar to the GCT, you will consume a glucose-rich solution, but this time it typically contains 75 grams of glucose. 4. Multiple blood samples. After drinking the solution, your blood sugar levels will be tested at intervals, usually at the 1 hour, 2 hour, and sometimes 3 hour marks after ingestion. This test can give more accurate insight into how your body processes sugar and confirm whether you are diagnosed with gestational diabetes.